People often think of football as causing neck problems, maybe headaches, concussions, things of that nature, but I wanted to share a case I had last week on a young man that came in who is an avid football player, sustained a pretty good hit, and his presentation of the problem was jaw pain. The young man, as he had gotten hit on the side, jaw obviously had gotten traumatized to a level and presented complaining of a lack of being able to open his jaw fully and a considerable amount of pain over the side here. This condition is called TMJ. Sometimes TMJ is a chronic condition, sometimes, like in this case of this young man, it can be a very acute, sudden impact that caused it. What is the problem with TMJ? Well, the jaw here is made up of two bones. You have the lower portion, or the ramus of the jaw, and you have the upper portion, which is the skull. There's an articulation that happens here, a joint, and there's a vast number of muscles that pass over that allow the jaw to move up and down as when we speak or eat, and that can get bruised. It can be, the joint can be slightly displaced, and the resultant is the nerves in the area get pinched, irritated, and can cause pain, whether it be pain at the site or headaches. This young man had a lot of pain, couldn't open his jaw quite fully, so we evaluated it. There was no fracture, there was no dislocation of the jaw, it was just a slight imbalance. So we got in there by utilizing some internal maneuvers. I glove my hands, get in there, work the muscles. This representing the ramus, the bottom part of the jaw, and this representing the portion of the skull. Get in and work the internal pterygoids, a big fancy name for some muscles that are on the inside of the jaw. Then I work the masseters, the outside portion of the jaw, and then work the temporalis muscles. Also evaluating the neck to make sure that that's moving properly and getting this to relax some. Followed up a couple of, I think it was 3 visits, and the young man's jaw was moving much more appropriately. He was doing some home care with ice and that, and was back to his normal function. So, you're talking with friends or family that may have had jaw problems and they've not had much success with the dentist, because typically when we think jaw problems we go to the dentist. If that's they're still having chronic problems, you might suggest that they go in and get seen by a chiropractor to do a proper evaluation of the TMJ and help their condition.